My name is Justin Brooks. I'm the Executive Director for the Gary Bernstein Community Health Clinic. We provide high-quality, free health care for people that don't have insurance. We're really excited to have you guys here and be a part of the Student-Run Free Clinic.
Students are asked to arrive at clinic in a timely manner for a brief tour of the clinic and overview of our EMR, Athena. Before the first patients arrive, students will perform a thorough chart review on their assigned patient. During chart review, students should review the reason for the office visit, the patient's health maintenance history such as pap smear and flu vaccination, and get familiar with the patient's past records at the clinic.
When a patient first arrives at the clinic, they will be checked in by one of the co-directors who will bring the patient to an exam room. Exam teams are composed of a third or fourth year student and a first or second year shadow, and they will see the patient together. After the third or fourth year medical student has taken the vitals, including a blood glucose, a detailed history, and performed the physical exam, the students will discuss the case with the attending or resident. If a physician is not currently available to staff, the third or fourth year student should start working on their note immediately as best they can.
If there is any need for medications, referrals for imaging, or specialty providers, or any procedures such as blood draws or pap smears, please find the co-director as soon as possible so that the necessary paperwork and materials can be provided. The exam team and physician will then return to the exam room and finish the visit.
After the visit, the patient will wait in the exam room for their medications. We ask that exam team members enter prescriptions into the EMR immediately before completing the remainder of the note so that the pharmacy can begin filling the scripts.
The medical student working in the pharmacy will grab the prescription and work with the pharmacist to properly dispense medication. After the pharmacist has confirmed the proper medication, the pharmacy team will bring the medication out to the patient and counsel the patient on general information, precautions, and directions for use of the medication. Please make sure the patient does not leave without their medication.
Before letting the patient leave, check in with one of the co-directors to ensure the patient has all the proper paperwork. After the patient has checked out, the exam team will complete the note and have it signed off by the attending physician. Exam team members will be assigned a second patient if available once their first note has been completed.
Medical students providing translation services will remain with the patient through the entirety of their visit. They will assist with any tasks as needed. Medical students may also have the opportunity to shadow a clinical psychologist and should expect different levels of involvement based on their provider.
Students are expected to arrive dressed in business casual with their white coats. Please remember to bring your laptop and a stethoscope. Thank you for volunteering at the Student Run Free Clinic.